All right, so first thing I'm going to do is knock on the door here. We are going to use this as sanitizer, so I need to sanitize my hands really well before I touch my patient. And when I go ahead and we're going to clean the stethoscope off, just so we can make sure we don't forget that. All right, nice and clean there. Perfect. All right, so my name's Christine. I'm going to be your nurse today. Can you tell me your name and your birthday?
Aiden, I was born on October 6th.
All right, so he knows his name and birthday. So everything's going to be confidential here between me, you, and the audience. Also, if you want, there's a blanket right there. You can use it if you need to just to cover up, okay? So throughout this assessment, I'm going to be inspecting for skin color, integrity lesions, moisture, swelling, and symmetry. When I palpate, I'm going to palpate with the back of my hands, and when I do that, I'm going to be checking for warmth with the front of my hands for tenderness, masses, and crepitus. All right, so first thing I'm going to do is measure some lesions. I'm going to take my little measuring device here. So let's go ahead and do this right here. There's a little mole thing. All right, less than 1 millimeter, so that is pinpoint. It is not raised, it's brown, and it is to be expected. Next thing you know, we are going to do, let's see, we're going to do a scar over here on your arm. Okay, that's what we're going to do. So length is up and down, width is across. So for the length, I'm going to say we are at 2 centimeters by 1/4 centimeter there. All right, so we've done our lesions. Okay, we already know your name and your birthday. Do you know who I am?
Yes.
Who?
Christy.
Okay, and where are we at?
In the basement.
Okay, and what are we doing?
Doing a project for my mom.
I like it. Okay, and do you know what the date is?
Monday.
Okay, I'll take Monday. That's fine. So he is alert because he's sitting up and talking to me, and he's oriented to person, place, time, and situation. So I'm going to be also assessing his facial expressions for appropriateness, and his voice for speech pattern, thought processes, perception, and mood and affect. All right, first I'm going to assess the scalp. So when I do that, I'm going to feel his head all around. We definitely need to move this skin here. It is, it's a little paler than the rest of his body, but there are no lesions, there are no pests. We're going to feel the scalp here. It is normocephalic. All right, so because I touched his hair, let's go ahead and finish up that area. I'm going to feel his hair. We're feeling all around. Hair is dry, non-brittle. It is evenly spaced throughout. So I'm going to go ahead and grab my sanitizer, and we're going to sanitize again because remember, you always sanitize when you do their hair. Next thing I'm going to do is look at the rest of your hair. So we got the eyebrows. They are nice and symmetrical and evenly distributed. And he has vellus hair, which is that little bit of peach fuzz, basically, throughout his face, arms, and legs, also evenly distributed. So we've done the scalp, hair, and skull. Next, I'm going to assess cranial nerve 7. That's the facial nerve. So I want you to smile, frown. I want you to raise your eyebrows, close them. Now close your eyes. Don't let me open them. All right, now go ahead and puff out your cheeks. And I'm going to blow it out. Okay, so that is cranial nerve 7. It's intact. Now I'm going to feel the temporal pulses. So I can feel that. That is a 1+ to be expected and regular. So next I'm going to do the TMJ. So when I do that, I'm going to feel right here. So I want you to open your mouth. Open it. Close it. All right, now you're going to laterally deviate, so go back side to side. All right, now you're going to protrude, so put your bottom jaw out. Now retract, bring it in. Okay, so good full range of motion in the TMJ. Now I'm going to test cranial nerve 5, the trigeminal nerve. So I'm going to feel right here. I want you to go ahead and clench your teeth. Now go ahead and let it go. Clench your teeth. Go ahead and let it go. So with that, I felt the temporal and masseter muscle. And now I'm going to have you do a test here. This is the sensory portion. I'm going to have you close your eyes and tell me where you feel this. Okay. All right, good deal. So cranial nerve 5 is intact. Now I'm going to feel the frontal and maxillary sinuses. So you tell me if there's any tenderness when I do this. Frontal and maxillary. Any pain when I did that?
No.
Okay. I'm going to go ahead and, because I was palpating, let's finish palpating that whole face right there. All right, skin is nice and warm throughout. So next thing you know, I'm going to do cranial nerve 2, 3, 4, and 6, the optic, oculomotor, trochlear, and abducens. First thing I'm going to do is the confrontation test. I'm going to put this behind you, and you let me know when you see it, but keep your head my way, keep your eyes my way.
I see it.
All right, we're going to do the other side.
I see it.
All right, so we got a good 180 degrees, which is to be expected. Next, we're going to do the cardinal positions. I'm going to have you follow my pen light with your eyes only. And his eye movement is nice and smooth. No nystagmus. And they appropriately crossed when I move the pen light to his nose. That is the convergence test. Now we're going to do the corneal light reflex. I want you to look straight at me. I'm going to shine the light right in the middle of your nose. Okay, so with that, the pupil's constricted equally. And one more time here. The reflection was at 6 o'clock and 6 o'clock throughout. Now I'm going to do the pupillary light reflex. So I'm going to put my hand here. I'm going to shine the light in this eye. They constricted. Now I'm going to go to the other one. And it also constricted. So that was direct pupillary constriction in the left eye and consensual in the right eye. So we're going to do the same thing over here. So this is direct in the right eye and consensual in the left eye. So we saw them constrict appropriately throughout. Next thing you know, I'm going to do the inspection. With that, I'm going to look at the conjunctiva. Can you pull your eyes down for me? All right, thank you. So they are nice pink, moist, with expected vasculature. I'm also going to look for the sclera and just look, kind of open your eyes, let me see them here. All right, so with the sclera, they are white, a little bit of vasculature, also no abnormal vasculature. I'm going to do the cornea, so just go ahead and look forward for me. I'm going to go from the side, the cornea, I'm going to come on this side. All right, the cornea are clear, as to be expected. I'm also going to look at the iris, that's the colored part of the eye, and they are brown, even throughout. So that is the inspection of the eye. Now we're going to do the ears, so I'm going to first palpate your ears. So I'm going to feel them. All right, any pain here? All right, so no pain with the tragus, that's to be expected. Now I'm going to do cranial nerve 8, that is the acoustic nerve. When I do that, I want you to plug one of your ears. I'm going to come back over here. I'm going to say 3 different things. I want you to repeat them for me, okay? Cat, house, bird.
Cat, house, bird.
Okay, let's go ahead and do the other one. All right. Dog, mouse, frog.
Dog, mouse, frog.
All right, so cranial nerve 8 is intact. All right, now we're going to do the nose. So I'm going to, I already palpated the nose. So what I'm going to do is I'm going to look on the outside of the nose, any abnormalities, and I do not see any. So I'm going to have you look up for me so I can see the nostril. All right, as I look in there, there is expected hair. There's a little bit of drainage. It is clear throughout. Now I'm going to have you check the patency. Go ahead and plug one nostril. Breathe in and out. And out. Okay, now let's do the other side. Breathe out. You gotta breathe in and out for me. Okay, so what I heard there was a little bit of congestion on both sides. So since he has congestion, I wouldn't be super surprised if he has some difficulty smelling. So we're gonna do cranial nerve 1, the olfactory nerve. Go ahead and close your eyes for me. I'm going to give you a couple scents and I want you to try to guess what they are. Can you occlude one nostril for me? So hide it, yep. All right.
That's taco something?
Yeah, taco seasoning. All right, go ahead and do the other nostril.
Cinnamon toast crunch.
I like it. It's cinnamon. All right, perfect. So what I'm going to do next is inspect the mouth. So when I'm looking here, I'm going to look at the lips. They are moist. There is no cracks, bleeding, lesions, or anything. Looks like someone needs a nap. I'm also going to assess the teeth. So go ahead and open your mouth for me so I can check out your teeth. You got to open it so I can see. There we go. All right. Teeth are a little off-white. They are even. I don't see any dental caries. Now you got to open your mouth for me. You can open your mouth bigger than that. Okay, we're going to check the buccal mucosa. That is the cheeks. Also open up so I can see the outside. Okay, go ahead and close your mouth for just a second. So buccal mucosa, nice pink and moist. Next, we're going to check out those tonsils. So I'm going to have you open your mouth. You guys stick out that tongue a little bit, like, Oh, open your mouth. Stick out your tongue. Okay, so tonsils are a 1+. Now I'm going to go ahead and have you do that again and say ah. Okay, so when he said ah, cranial nerve 9, the glossopharyngeal was tested. That's when that uvula moved. And then cranial nerve 10, we expected the palate to vibrate, and it did so. Next, we are going to do cranial nerve 12, the hypoglossal. I want you to stick out your tongue and then just stick it straight out. Okay, go ahead and close your mouth. So it went in and out, and it was even. All right, next we're going to do the lymph nodes. So I'm going to set this down here. So I want you to just tell me if there's any pain, okay? This, preauricular, postauricular, occipital, submandibular, submental, anterior cervical, jugulodigastric, posterior cervical. I'm going to have you shrug up your shoulders. This, not that far. This is the supraclavicular, and now I'm going to have you look that direction.
Do the same thing.
Deep cervical, no, just look that way. Deep cervical chain, go ahead and look the other way. And deep cervical chain. I didn't feel any of his lymph nodes, which is to be expected.
It feels weird.
I know, it feels a little weird. Okay, so next thing you know, we're going to do the carotid. So let me go ahead and palpate that neck. And skin's actually a little bit warmer on the neck over the face. So when we palpate the carotids one at a time, I'll let you get that out. Okay. All right, good, 2+ throughout. Now I'm going to auscultate for a bruit. Bruit is turbulent blood flow, indicating potential blockage. We need to do that with the bell of our stethoscope. All right, I'm going to go ahead and just have you hold your breath for me. All right, go ahead and breathe for me. Now go ahead and hold your breath. All right, good deal. So we don't want to hear a bruit, and I did not hear one, so that's expected. Now we're going to do a range of motion of your neck. I'm going to put my hand back here. I want you to flex your neck, so look down. Extend your neck, so look up at the sky. Now I'm going to have you laterally bend it, so you're going to go, yep. Now go the other way. Now I'm going to have you rotate it, so just look one way and then the other. All right, good deal. So I'm going to look at that trachea. When I look at it, it's nice and midline. If you can't see it, you can shine a little bit of light there. So don't look up for me, bud. All right, trachea is nice and midline. I want to feel it. Okay, now I'm going to palpate the thyroid. Go ahead and swallow for me. All right, I felt the rise and fall of the isthmus as to be expected. Next, I'm going to do cranial nerve 9. That's the spinal accessory nerve. So I'm going to put my hands here. Go ahead and shrug those shoulders. All right, now I'm going to put my hand right here. Go ahead and look towards my hand. All right, same thing. All right, so that cranial was intact because he was able to do that, and he had 5+ strength. All right, now I'm going to go to the back. Do you mind flipping around just for the camera? Please make sure you remember side rails up as appropriate. So first thing I want to do is inspect. As I'm looking at the thoracic cage, it is an elliptical shape, which is that oval shape, and downward sloping ribs. I'm going to palpate. So feel all around. I'm going to palpate this way. Palpate the spinous process. Sorry, I know that might tickle a little bit. Now I'm going to do lung expansion. So I'm going to put my hands here, pinch just a little bit. Go ahead and take a deep breath for me. All right, good deal. So that was even. We expected as he took a breath to have an equal movement. Next thing you know, I'm going to percuss. So we're going to percuss for resonance. So I'm going to have you kind of give yourself a little bit of a hug. Yeah, you don't want to push your arms that far though. Not that far. There we go. All right, so make sure you don't palpate over any bone. We're going to do it 9 spots. I know, it feels a little weird. 3, 4, 5, 6, 7. I'm going to go to the side here. 8, 9. So I heard resonance throughout, which is the expected finding. All right, now I'm going to go ahead and do CVA tenderness. When I do CVA tenderness, what you're going to feel is my hand over you like this, and then that pounding right there, okay? You tell me if there's any pain. So, any pain? All right. Any pain there? Perfect. Now I'm going to go ahead and auscultate. So, I'm going to just turn this here. Make sure you flip it over to the diaphragm. I'm going to have you do that little bit of a hug again. All right, you're going to take a deep breath in and out. Let me know if you need a break, okay? Go ahead. We're going to go ahead and do one more just in case. All right, so in assessing that, I heard clear lung sounds throughout. You go ahead and relax. Clear lung sounds throughout. Out here it was vesicular, and right here it was bronchiovesicular. So I'm going to go ahead and have you flip on around. So in doing this, I'm going to assess the breathing, the work of breathing. It is unlabored, regular rhythm, and normal depth. So I'm going to go ahead and palpate. Sorry, does that hurt?
Oh, this side.
Okay, I'll be gentle there. All right, so the skin is warm, even throughout. So now I'm going to do the AP transverse ratio. So go ahead and sit straight up for me. AP transverse. So that is a 2-to-1 ratio to be expected. That says he does not have barrel chesting, which is good. Next thing you know, we are going to do palpation. So I'm going to do this, or I've already done palpation, so we're going to do percussion. I'm expecting to feel resonance or hear resonance, which is what I heard on the back. So. Remember, we don't do this over bone. Go ahead and kind of open up your arms just a little bit. All right, go ahead and relax right there. So I did do it 6 times there just to make sure I covered up all the lung fields. Let me go ahead and actually do it up here because I want to make sure I get that, the apex. Okay, there we go. I did do it, like I said, a couple times, but you want to make sure you cover the whole lung field. You only have to do 5 throughout each of those times. Now I'm going to go ahead and auscultate. So that means I'm going to listen. You're going to do the full breath in and out each time I move the stethoscope, again with the diaphragm. So we're going to listen to the apex. Go ahead, Brett. All right, so I heard bronchial sounds right here at the neck, bronchiovesicular here, and then vesicular throughout the rest, all of which were clear sounds. I'm gonna do the upper extremities, so go ahead and just kind of put your arms like so I can feel them. All right, so we're gonna feel the entire arm, palpate it. Now I'm gonna do it this way, our temperature, nice and warm, even throughout. All right, go ahead and lay it down. We're going to inspect, take a look at those extremities. Now I'm going to go ahead and find the pulses. So I'm just going to feel here, feel the brachial pulse. Relax. All right, I'm going to come down here, feel the radial pulse. Brachial pulse was a 1+, radial pulse was a 2+, and they were even and regular rhythm. Now I'm going to do skin turn. Go ahead and put those hands out like this. You're going to feel me kind of, I'm not going to like pinch your skin. Go ahead and relax them though. So I'm going to pinch up the skin. I'm going to pinch up the skin over here. And what I'm looking for is that brisk return. So he had brisk return showing good hydration status. Now keep those hands out. I'm going to do, look at those nails. And looking at the nails, they are evenly distributed, pink nail beds. We have a 160-degree angle. Let me go ahead and see the other side there. Also pink nail beds, 160 degrees, which is to be expected. All right, we're gonna do cap refill. So I'm gonna squeeze all those fingers. So squeeze. What I'm looking for here is the cap refill is less then 3 seconds. And slow down a bit. So if you can see, we pink up a little bit, and then that's good blood flow. So cap refill less than 3 seconds throughout. Now I'm going to do some range of motion. So just kind of follow along with what I say. Go ahead and sit up. I'm going to have you flex your arms. So go ahead and put them straight out in front of you. No, straight out towards me. All right. Oh. Now I'm going to have you extend your arms to put them straight back behind you. Hold on. I'm going to have you flex this way and then extend that way.
Oh, like this?
Yeah, so like put your arms back like that, like you're flying. Okay, go ahead and let's do that again. So flex towards me. All right, extend, go straight back. Okay, now I'm going to have you abduct. So what you're going to do is put here in a second, you're going to put your arms straight out when I tell you to go. So go ahead, abduct, straight out. And I'm going to have you adduct. So go ahead and put them like in front of you together. Like this. Those arms back out. There you go, perfect. Now I'm going to have you internally rotate. So put your arms behind you like you're going to jail. Now I'm going to have you externally rotate. So put them behind you like you're relaxing on the beach. Put them behind your head. All right, good. Full range of motion. Go ahead and relax for a second. Go ahead and raise those shoulders again for me. Okay, so like I said, a 5+. So full range of motion. Now I'm going to have you do your elbows. So go ahead and flex them. So bend them towards you. Now go ahead and extend them. Push them away. There you go. Now I want to have you pronate. So open up your palms for a second. Now put your palms face down. Now I'm going to have you supinate. Put the palms face up. Okay, full range of motion there. I'm going to have you go ahead and bring your arms up towards you. I'm going to have you go ahead and push them down. All right, full range of motion of the elbows and 5 strength muscle. Now I'm going to do the wrists here. Go ahead and flex. Hold on a second. Hold on. Go ahead and relax for a second. I'm going to have you flex them. So put them like down. Like this.
Mine.
Yep. Okay, now extend straight up. Yep. Okay, now I'm going to have you here in a second do a radial deviation and ulnar deviation. So put radial, that's thumbs towards each other. Now ulnar is the other way. Okay, now I'm going to have you, when I put my hands here, you're going to raise your hands like that. Okay? Push me away. All right, so full range of motion of the wrists, and also he does have a 5+ strength. Now, let me have those fingers. I'm going to have you here in a second flex the fingers and extend them. Okay, but I want to feel, so relax. Okay, now flex, now extend. Okay, very good. So again, we've got good range of motion. Now I'm going to have you do a grasp. I'm going to put my hands like this. I want you to squeeze my fingers. Just, or pull me towards you, just squeeze them. All right, thank you. So good muscle strength. Remember, arms need to be crossed. Now we're going to do the precordium. So go ahead and lie down for me if you don't mind.
This way?
I don't care, whatever way you want to lay down. All right, so first I'm going to inspect for any pulsations, any heaves, any lifts. As I look, you might use your pen light. I don't see any. I'm going to use the palmar aspect of my hand. Put my hand right here. I feel his heartbeat, so a little bit of pulsations, but no thrills. All right. Next, I'm going to auscultate. When I do that, I'm going to do the aortic valve. That is the right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Erb's point, which is the third intercostal space, left sternal border. Tricuspid, left sternal border, fourth intercostal, and then the mitral valve, which is the fifth intercostal midclavicular line. So as I do that, I'm going to go ahead and listen. When you do the precordium, we're going to feel for a couple good beats. Feel. All right, we got that side. I'm going to flip this over to hear if I hear any murmurs. All right, S1, S2 heard throughout, regular rhythm. Now I'm going to listen to that apical pulse. I'm going to do this for a full minute, counting the entire time. So we'll fast forward and say it's been a minute, and we'll say his apical pulse was 82. It was regular and to be expected. All right, now I'm going to look at his stomach. You want to look at the abdominal contour. His stomach is flat. I see no extreme pulsations throughout. The contour is flat. The umbilicus is inward, so it's inverted. Next, we're going to auscultate. We're going to auscultate and listen before we ever touch the stomach. So when we do this, we're going to listen with the diaphragm. And I'm going to move it if I hear the gurgle. All right, then we're going to flip this. I'm going to listen for a bruit, also turbulent blood flow, indicating potential blockage or an abdominal aortic aneurysm. He does not have a bruit, which is to be expected. Now I'm going to percuss, so it's just going to be that drumming. So that's tympany, which is what we expect. Now I'm going to palpate. Let me know if you have any pain. I'm looking at his face here. And no external signs of pain, so that is to be expected. Now go ahead and, well, no, we're going to leave you sitting down. I'm going to go ahead and do the extremities. So I'm going to pull your pants up a little bit right here, okay? I'm going to palpate the extremities. Go ahead and uncross those legs. I'm going to actually take off your socks too. Now we're going to use that hand sanitizer because I did touch his toes. Okay, now we're going to go back to palpating. Remember, he does have a bottom of his legs. Come over here, make sure you get up to that hip. Now we're going to go here. Remember, you got the bottom of the legs. There we go. All right, good even temperature. Toes are just a little bit colder than the rest of him. Now I'm going to do edema. I'm going to go ahead and press right here. For the count of 5. Look here. Skin came right back. No edema. Now I'm going to feel the posterior tibial pulse. So I'm going to reach around here. And that's a 1+. And I'm going to feel the, the dorsalis pedis pulse. That's a 2+. Now we're going to do cap refill of all 10 fingers, or all 10 toes. I'm looking for that good brisk return. All right. And throughout, we have less than 3 seconds. Now I'm going to use hand sanitizer again. Okay. All right, so now we're going to go ahead and do the range of motion of the extremities. Go ahead and come over this way for me. So go ahead and lay down still. Down and bring your hip over here. Lay on your back. There you go, you got it. So please remember that if I am on this side over here, that side rail would normally be up. So I'm going to feel your hip here. Remember, you cannot feel over clothing, so I'm going to have you flex your hip. So straight leg, straight up. Now I'm going to have you extend it. So go ahead and bring it off the side of the bed there. Bring it down. Okay, good extension. Now I'm going to have you go ahead and straighten out your leg again. Abduct, so bring your leg straight out like this. Adduct, bring your leg straight across your other leg. Okay, now we're going to have you internal rotate, so bend your knee. I'm going to have your knee go that way. Nope. Knee, yep. Now externally rotate this way. Okay, good deal. Yep, perfect. So I'm going to have you go ahead and start to go that side. I would raise the side rail up here. Come on this side and, ooh, don't go too far. We don't want our patient to fall. I'm going to do this side here. Okay, flex, leg straight up. Extend, leg down and off the bed. No, down. Yep, there we go. Now abduct, leg straight out. Adduct, leg that way. Now internal rotate, go ahead and bend your knee. And bring your knee that way. Not your whole foot, just your knee. Yep. Now externally rotate this way. All right, go ahead and get right in the middle for me. All right, so both side rails would be up. I'm going to go ahead and do the knees. I'm going to put my hands here. Go ahead and have you bend your knees. That's flexion. Now straighten them out. Extension. All right, good deal. I'm going to go ahead and come down here to the ankles. So I'm going to put my hands right here, feeling the ankles. Go ahead and relax for me. I'm gonna have you flex the ankle, so that means bring your toes towards your nose. Now extend them, so push down. Oh, I switched those actually. Flex, extend. Nope. So this is plantar flexion. Go back up to your nose. That's dorsiflexion. Okay, now go ahead and relax. I'm gonna have you invert, so put your toes that way towards each other. Now evert, opposite. Okay, perfect. So now I'm gonna have you again, relax, put your toes towards your nose. Okay, so again, that's dorsiflexion, and then push down like a gas pedal. Plantar flexion. So full range of motion of the lower extremities, even no crepitus felt throughout. So I'm gonna go ahead and use my sanitizer again because I touched those feet. Okay, I'm gonna throw it on the ground. All right, I'm gonna go ahead and do the Babinski reflex. So going to have you come over here with the camera. So with this, I'm going to run this up here. All right, go ahead and close your eyes for me. Gonna go this way. Okay, good deal. So his toes scrunched together, they went down. That is a negative Babinski and a positive plantar reflex, which is the expected finding. We don't want those toes to curl out. Okay, go ahead and sit up on the side of the bed for me. Because I touched those toes, I'm gonna go ahead and sanitize again. All right, so now you are going to put those arms out, and what you're gonna feel, you can relax them though, you're gonna feel either a dull or a sharp. Okay, you tell me what you feel. Go ahead and close those eyes.
Sharp.
You gotta say it loud enough.
Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay, I'm gonna do your legs now. So,
Alright, close my eyes for this.
yep, close those eyes for me. Relax.
Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp.
Okay, so good sensation throughout. Now I'm gonna have you go ahead and stand up for me. And you're gonna walk just 10 steps away. No, not karaoke style, just straight.
That's within.
All right, now go ahead and walk 10 steps the other way. Like walk 10 steps away normally and then 10 steps towards me. All right, so gait is even throughout. Come back towards me. All right, so gait's even, opposite arm swings as to be expected. Now, last thing we gotta do is that back. So I'm gonna have you turn so they can see. And turn, okay. Back up, there we go. So first thing I'm gonna do is palpate that spine, or I'm gonna look at the spine for symmetry. It is even throughout, shoulders and hips are in alignment. I'm gonna go ahead and have you bend forward for me. All right, a little more. Okay, so now I'm feeling that spinous process. There is no curvature as to be expected. Go ahead and stand up for a minute. Now I'm gonna put my hand here. We're just gonna do some range of motion. So you're gonna flex, so you're gonna bend down. Now you're gonna extend, opposite. Yep. Now you're gonna laterally bend, so you're gonna do this. Yep. Now the other way. Now you're gonna rotate, so you're gonna like twist your body. Nope, not like that. Like this. Just turn like this. Here, hold on, let me show you. Like this. Okay, I gotta feel it. Okay. All right, so full range of motion of the spine, no crepitus. So we're done here with your assessment. I appreciate your time. Thanks.